Chief Minister. Just say a couple
That's
of words.
okay, yes?
That's better.
Testing? Okay, all right.
That's it.
I'm not sure whether that was live, everyone. Apologies, but a little bit of an audio problem. Okay, so to recap, 25 new cases overnight, 12 linked, the remaining under investigation. 9 of the cases were in quarantine during their entire infectious period, and 16 are under early investigation. The rest are assessed as not presenting a risk of transmission to others. We had 3,637 tests yesterday, so another very high level of testing. Thank you to everyone who came forward. We have 17 people currently hospitalised, 5 in intensive care, all of whom require ventilation. Now, on vaccination, Canberrans should be very proud of our very high levels of vaccination. We are on the path to becoming one of the most vaccinated cities in the world. We now have 97.1% of our eligible 12-plus population with the first dose of a vaccine. 12 to 15-year-olds have undertaken the fastest vaccination uptake, and they are now at nearly 85% first dose. But because they were the last cohort to be able to access vaccination, their second dose rate is only 7% at the moment. I'm pleased to report that 20 to 24-year-olds have now crossed the 75% first dose threshold. Now, this is good, but it is still sitting a full 20 percentage points below the territory average. Every other age group has done better than this. Now, we suspect that border closures and remote learning means that some of this age group, principally university students, are actually not in Canberra at the moment. But it is important that they get vaccinated ahead of their return to campus in the coming months. So we'll be working with the universities and the Canberra Institute of Technology on this vaccination priority. Pleased to report that 69.3% of the 12-plus eligible population is now fully vaccinated. And over the coming 3 weeks, the bulk of the Territory's vaccination program will be second doses. There are around 40,000 bookings for second doses in ACT government clinics alone in the coming weeks. We're going to work hard to ensure that anyone who wants access to a vaccine can access a first dose before the 15th of October. We want to get as close to 100% vaccination coverage as we possibly can. And based on current hospitalisation rates, for every 1,000 people that we vaccinate, we can expect about 80 fewer to require hospitalisation and acute or intensive treatment. Now, there are around 10,000 first dose bookings in our system for the week ahead, but there are also plenty of vacant slots. Put your name against one of those vaccination vacancies. You can do it today. To recap, 25 new cases, 12 are linked, the remaining under investigation, 9 in quarantine, 16 under early investigation, the rest assessed as not presenting a risk of transmission to others, 17 in hospital and 5 people in intensive care. I'll now hand to Dr. Coleman to provide some further information on the new cases, and then we're happy to take questions. Thank you.
Good morning, everyone, and thank you, Chief Minister. So, on today's numbers, we have 25 new COVID-19 cases that have been notified since our last outbreak. This brings the total cases for the outbreak to 1,172, and the total number of recovered cases now at 736. We currently have 430 active cases. As the Chief has discussed, out of the total 25 new cases today, 12 can be linked to known cases or ongoing clusters, with 13 under early investigation. And of the 12 linked cases, we know that 9 of these are household contacts. Of the total 25, 9 were in quarantine during their whole infectious period. And of the remaining cases that have been assessed to have spent time in the community, none of these present a risk of transmission to others. Now, while this is great news so far, I do need to note that due to the timing of these coming in fairly late in the afternoon, early evening, 16 do remain under early investigation, and these are being conducted this morning. To 8 p.m. last night, we have 17 people in our hospital. 2 are fully vaccinated, 11 of these are unvaccinated, and 3 are partially vaccinated. 5 people in ICU, with all 5 requiring ventilation. And my shout out today is actually to all those people that I think go unnoticed while all our focus is on COVID. I really know that many of you continue to work in a range of roles, in public, private and community sector roles, undertaking BAU activities to keep our city and community functioning. I know that this can be challenging and it's been really hard to do this outside of your office or places and environment in which we normally do work, but your contribution and your ongoing efforts do not go unnoticed. Thank you very much, and I'll hand back to the Chief.
Thank you, Dr. Coleman. Happy to take questions.
Good morning, Chief Minister. From Monday, New South Wales will reopen regionally. How worried are you?
What remains to be seen, really. It's difficult to tell exactly what will happen. As I understand, their travel advisory is, though that's within region, not Greater Sydney into the regions. That they're not going to make that move until some time later. For ACT residents, we will not be changing the travel arrangements whilst we are in lockdown. But as I've indicated previously, the next step for us will be an expanded regional travel exemption arrangement. And then beyond that, we would look to even greater travel within regional New South Wales. And then beyond that would be free travel, but that will take place. The first step from the middle of October, the second step likely from the end of October, and then the final step in late November, early December.
And lots of people in those border communities that are unclear on what's happening on Monday in terms of coming in and out of Canberra. When will we know more details from the Cross-Border Commissioner about just what people will be able to do in those communities?
So nothing changes in terms of the ACT New South Wales current arrangements until we come out of lockdown on the 15th. So for the next 5 days, things remain the same. Beyond that, we'll hear from New South Wales ahead of the ACT coming out of lockdown, and we will make some further announcements. We've already signalled that in the first instance, that will be expanding the number of proximate postcodes with a standing exemption in relation to travel into the ACT. That's anticipated to be for the 2-week period from when we come out of lockdown until the end of October, by which point we anticipate that both New South Wales and the ACT will have crossed over 80% of their respective populations being fully vaccinated. That will then trigger another increase in freedom of movement between the two jurisdictions. Remains to be seen exactly what New South Wales' policy approach will be around localised lockdowns, localised hotspots, and the distinction between the Greater Sydney area or local government areas of concern even within Greater Sydney and freedom of travel around regional New South Wales. So there's a few more steps to go. as a starting principle, we will certainly want to work closely with New South Wales, and as has been our practice in the past, we've sought to align, wherever they have declared either a lockdown or a hotspot, we have followed in terms of having a clear and consistent approach to replicate their own decisions about their risk points within their state.
And looking further afield to, say, Victoria, given that's the other state that we might have open borders with sort of soonish. At the moment, we're considered like a red zone. Do you have any indication of when that might change?
Yes, so I think they've indicated that they'll be moving us from extreme risk into the orange zone that would allow Victorians who are in the ACT to return back to Victoria. Their vaccination rates are just a little bit behind ACT and New South Wales, not too far, a couple of weeks it would seem, and that's largely about the dosing interval. Their first dose rates are now over 80%, which is very encouraging. So I think we can look with great certainty at December and say that every expectation is that borders would be open in December, so people can definitely make Christmas and summer holiday plans for South Coast, for Victoria, based on their current vaccination rates. It's the period between 15 October and the 1st of December that I think things will be done in stages, and it will be somewhat dependent on the decisions of the New South Wales and Victorian governments. But our intent is to get as many Canberrans vaccinated as possible ahead of border reopening. We're doing exceptionally well there. But of course, just the reminder to everyone is it's second doses that are the most important. And so for some of our age cohorts, the 12 to 15-year-olds that I mentioned earlier are only at 7% second dose. And just looking at the data, for example, our 16 to 19-year-olds are only 39% fully vaccinated. Our 20 to 24-year-olds, 37% fully vaccinated. 25 to 29 is only 47% fully vaccinated. In the 30s, it's nearly 57% for 30 to 34-year-olds, and for 35 to 39, it's 62%. Now, we've got, as I mentioned, tens of thousands of second doses going into people's arms in the coming weeks, but you're not protected against the virus as effectively until you are double dosed. And so the balance of October from here until the end of the month is about completing that vaccination program and giving those 100,000 people full protection. So we're not going to be doing anything crazy with restrictions or border easing until we've got that cohort through and they've got their second dose. So I don't really care what New South Wales do. We will still be cautious over the next 3 weeks.
Sorry, just for complete clarity on the inside the regional bubble, from when we leave lockdown next Friday, will non-essential travel be permitted? So if I want to go to the Murrumbidgee wine region on Saturday and have lunch, am I allowed to do that? We're no longer in lockdown.
Well, you would need to be fully vaccinated to travel into New South Wales. We will assess in terms of our requirements around travel into regional New South Wales, whether essential or non-essential will still be in place for the 2 weeks between 15 and 29 October. So if you want absolute certainty about when you can go to a winery in Murrumbidgee, I think I'd be looking more to November and December rather than October. But we'll clarify that situation and be very clear with everyone around non-essential travel within the region when we get closer to that time.
Canberra shouldn't be booking a pub in Queanbeyan next week or the weekend after?
No, they shouldn't. They can go to a pub in Canberra.
And in terms of expanding that regional bubble, is there any more clarification of where that region might expand to?
Well, we will announce that, but it will be greater than the current number of postcodes, but not significantly greater. Like, it's not going to stretch up to the Hunter Valley or Sydney, but it will be greater than the current arrangements. And that would apply for the 2-week period between the middle of October and the end of October. As I say, we've got a 6-week adjustment period from mid-October until the 1st of December, where there will still be a range of restrictions. Things look a lot freer after the 1st of December. Of course, that's partly driven by New South Wales' requirement for only vaccinated people to be able to travel within New South Wales up until the 1st of December.
And in terms of some of these other events in summer, like coming up and people wanting to make plans for parties and that kind of thing, you speak to the tourism operators and they're getting concerned that it's getting too late to sort of start booking those things. I'm wondering if there's any clarity you can give to them, or any hope that some of these big New Year's Eve and Christmas carols and all that will return to Canberra?
To Canberra, yes, we'll certainly, our roadmap would allow that with certain caps on the number of attendees and 1 per 4 or 1 per 2 square metre rules, depending on whether the event's indoor or outdoor. And that's laid out in the pathway forward, but doesn't come into effect fully until the end of November. So there's a transition phase, as we've said dozens of times. We'll be stepping gently out of our lockdown 15 October, and then a further easing of restrictions at the end of October.
Just some questions for the Chief Health Officer. Thanks.
Certainly. I should indicate that this will be the last Saturday press conference of this kind. We won't be here tomorrow either. We'll simply issue a statement, but we'll be back on Monday. Dr. Coleman.
G'day.
Hello.
Hello. Could we just get an update on the special care nursery? Are there any additional cases associated with that cluster?
Yeah, no, my understanding is that there's no additional cases associated with that, so the number remains at 5.
And are we any closer to understanding how the virus got into that part of the hospital?
No, those investigations are ongoing.
And just one more on that topic. I believe there's a number of babies who are considered close contacts that are leaving quarantine either today or tomorrow. Can you tell us a bit more about that? Have they all been cleared already?
So I do have information on that, but you might need to give me a second while I find it. Just give me a second. Apologies, everyone. I have a pile of papers here and sometimes I just can't find what I need. So we're talking about the babies and their families in quarantine.
Yes.
So we understand that we have 4 babies who are casual contacts, and we have a series of carers which are caring for those. If they return a negative test today, they'll be able to visit those 4 babies. But then we do have some other babies and carers who are close contacts, and they'll need to be quarantined for a little bit longer until Monday with a negative test. So I think I just reassure everyone that there is a lot of work going on within the special care nursery and in the surrounds to provide as much non-contact support between those the babies and their carers. And there's also been some work done on providing express milk deliveries. So all of those needs that we can meet while maintaining quarantine are being conducted.
And just on vaccines, we are at the cusp of reaching 70% double dosed. Are we ahead of schedule? How does it feel to get to that stage?
Oh, look, I think it's absolutely fantastic. And as the Chief talks about every day, I think each and every one of you and every one of anyone who's had anything to do with this progress should be incredibly proud. I don't know if people remember, but when we started this journey, it seemed like a mammoth task. None of us had ever worked on how we would stand up a mass vaccination clinic and what on earth does that look like? How do you roll out a vaccination program that quickly? And how do we get so much support from community behind us? But it's fantastic, and it's set us up really, really nicely for the next several months of our transition journey.
You mentioned relatively low vaccine rates in that 16 age group, that cohort. Are they presenting in hospital at a higher rate that you're noticing?
So what we've noticed is that we are definitely seeing more cases in those age cohorts where there's a lower vaccination status. And I think that was very prominent at the start of the outbreak, but we are definitely seeing more hospitalised, reflecting both that age-dependent risk profile that we see as well as the unvaccinated. I think, to be fair, this lower age group is the last that have been eligible, so we do need to give them a little bit of time to catch up. But guys, get out there and make an appointment and come and get the vaccine. There are appointments today. Thank you very much.